Vitamin D, pills, sachets, or injections? Find out what's best for you. Discovering the ideal way to supplement vitamin D can dramatically improve your overall health, especially when it comes to bones, muscles, and your immune system. But here's where it gets controversial. With so many options available, pills, sachets, or injections, how does one decide which method is right for them? Vitamin D, often referred to as the sunshine vitamin, is essential for converting calcium and phosphorus into the sturdy building blocks of healthy bones and teeth. It also plays a crucial role in bolstering immune function and supporting smooth muscle operation. While sunlight remains the primary natural source of this vitamin, many people, particularly in the winter months or those who spend most of their time indoors, find themselves not meeting the daily requirement. For these individuals, supplemental vitamin D becomes not just beneficial, but necessary. Understanding the core methods of vitamin D supplementation. There are three primary ways to incorporate vitamin D supplements into your routine: pills, available as tablets or capsules, sachets, which contain powdered granules, and injections, delivered directly into the bloodstream. Each method is tailored to meet different health needs and lifestyle considerations. Vitamin D pills, the everyday option. For most individuals, pills are the go-to option for vitamin D supplementation. They are especially effective for those with mild to moderate deficiencies and for people who simply want to maintain balanced vitamin D levels. This method is ideal if your body naturally absorbs nutrients from food without difficulty. Advantages include ease of use and wide availability. Suitability for long-term daily supplementation. A well-regulated dosage that fits both adult and child needs. However, pills might not be the best choice for everyone. Individuals suffering from digestive disorders such as Crohn's disease or celiac disease, which impair nutrient absorption, may find pills less effective. Moreover, if you have a tendency to forget your daily medications, it might be wise to consider an alternative method. Vitamin D sachets, the convenient high-dose boost. Next up are sachets, which contain a potent powdered form of vitamin D, typically mixed with water. These sachets are taken once a week, or as directed by a healthcare professional, and are particularly useful for those needing a quick elevation in their vitamin D levels. If you struggle with swallowing pills or require a short-term high dosage because of moderate deficiency, sachets may be your best bet. Key advantages include a powerful dose provided in a single serving. An easy-to-ingest form for individuals who dislike taking pills. Rapid improvement in vitamin D levels when a quick boost is necessary. Nevertheless, sachets are not universally appropriate. They should be avoided by individuals with severe kidney issues or a predisposition to kidney stones. Additionally, if you have any allergies to the ingredients in these sachets, caution is advised. Pregnant or breastfeeding women, unless specifically directed by their doctor, should also refrain from using them. Vitamin D injections, the direct and quick fix. Vitamin D injections are less frequently used but are a critical option for those with severe deficiencies or significant absorption issues due to conditions such as digestive system disorders or after certain surgeries. Administered by healthcare professionals, these injections ensure that vitamin D is delivered directly into the bloodstream, thereby bypassing any digestive complications. A notable advantage is that they require much less frequent dosing, often on a monthly schedule or even less frequently. Benefits of this method include a rapid and reliable restoration of vitamin D levels, particularly in severe cases. Enhanced effectiveness for individuals with significant absorption challenges. An advantage for those who may not be consistent with daily or weekly supplementation. Nonetheless, injections are generally reserved only for those with clinically diagnosed vitamin D deficiencies. They are typically not recommended for individuals without a clear medical need, and caution is also advised for pregnant women or those planning to conceive unless under specific medical guidance. So, which option is right for you? Choosing the right form of vitamin D supplementation comes down to your specific health needs and the professional advice of your doctor. Pills are a reliable and convenient option for healthy children and adults who have no nutrient absorption issues. For those who need an immediate boost or have difficulties with swallowing, sachets present a viable alternative. In contrast, injections are usually reserved for those facing severe deficiency or serious absorption problems, and their administration should always be managed by a healthcare provider. And here's the part most people miss: this isn't a one-size-fits-all solution. It's important to have an individualized evaluation by a doctor, who can determine the safest and most effective treatment based on your unique medical background. What are your thoughts on these different methods? Do you agree with the tailored approach, or do you think one method clearly surpasses the others? Let us know in the comments. Your perspective could spark a valuable conversation. 10 surprising side effects of vitamin D deficiency you need to know. ### 10 unexpected consequences of vitamin D deficiency. 1. Depression ***. Did you know that depression can be a significant indicator of a vitamin D deficiency? Research indicates that individuals with insufficient levels of vitamin D are at a heightened risk of experiencing both depression and anxiety. A review published in 2022 highlighted that those lacking this vital nutrient are 75% more likely to develop depressive symptoms compared to their adequately nourished counterparts. Furthermore, the severity of depression and anxiety symptoms appears to correlate with vitamin D levels. The lower the levels, the more intense the symptoms, as suggested by a 2020 study. 2. Prostate cancer ***. Emerging studies suggest a troubling link between low vitamin D levels and an increased risk of prostate cancer, including a higher mortality rate from the disease. A 2025 study revealed that many patients diagnosed with prostate cancer had notably low vitamin D levels, particularly those with metastatic prostate cancer, which is cancer that has spread beyond the prostate. Additionally, a meta-analysis from 2018 found that individuals with higher vitamin D levels had a significantly lower risk of dying from prostate cancer compared to those with deficiencies. 3. Dementia ***. The relationship between vitamin D and dementia is becoming increasingly clear. A study conducted in 2014 found that individuals with vitamin D deficiency were 51% more likely to develop dementia, with those suffering from severe deficiency facing a staggering 122% increased risk. Recent research from 2023 further supports these findings, indicating that individuals with adequate vitamin D levels are 40% less likely to develop dementia, particularly among women. 4. Psoriasis and psoriatic arthritis ***. Psoriasis is an autoimmune disorder characterized by itchy, scaly skin, and approximately 30% of those affected also develop psoriatic arthritis, which leads to joint pain and stiffness. Both conditions have been associated with low vitamin D levels. A 2022 study found that lower vitamin D levels correlate with more severe symptoms in both psoriasis and psoriatic arthritis, emphasizing the importance of maintaining adequate vitamin D levels for skin and joint health. 5. Heart disease ***. Heart disease remains the leading cause of death among adults in the United States, and its connection to vitamin D levels is significant. A review from 2021 found that individuals with low vitamin D levels were 1.4 times more likely to suffer from heart failure, with those having very low levels being twice as likely to experience this condition. A subsequent review in 2025 confirmed these findings, noting that individuals with the lowest vitamin D levels had the highest mortality rates from heart disease. 6. Pneumonia ***. Vitamin D deficiency can increase the likelihood of developing pneumonia by 1.64 times, according to a 2019 meta-analysis. Those deficient in vitamin D are also more prone to severe cases of pneumonia. A 2021 study indicated that pneumonia patients with higher vitamin D levels experience fewer complications, while those with lower levels face increased risks of complications and mortality. Another study from 2019 reinforced this, showing that lower vitamin D levels resulted in more severe pneumonia and extended hospital stays. 7. Schizophrenia ***. While about 37% of the general population is vitamin D deficient, this figure rises to approximately 70% among individuals diagnosed with schizophrenia. This connection is complex, as those with schizophrenia often have poorer diets and health outcomes. However, research suggests that children who are vitamin D deficient may be at a greater risk of developing neurological disorders, including schizophrenia, later in life. 8. Multiple sclerosis ***. Individuals with vitamin D deficiency are 54% more likely to develop multiple sclerosis, MS, compared to those with sufficient levels of the nutrient. Furthermore, higher vitamin D levels may influence the progression of MS. Individuals with adequate levels tend to experience fewer relapses and slower disease progression. Similar patterns have been observed in Parkinson's disease, where low vitamin D levels are associated with more severe symptoms and faster disease progression. 9. Lower cancer survival ***. Research indicates that low vitamin D levels may negatively impact cancer survival rates, although specific details on this relationship require further exploration. 10. Reduced longevity ***. Studies suggest that individuals with low vitamin D levels may have a shorter lifespan compared to those who maintain adequate levels. This trend holds true even for those who consider themselves healthy. A 2019 review linked vitamin D deficiency to increased all-cause mortality, even among individuals who reported being in good health. Additionally, a 2020 review found that severe vitamin D deficiency significantly raises the risk of death, disease, and infection. In conclusion, the implications of vitamin D deficiency extend far beyond mere bone health. From mental health issues like depression to serious conditions such as cancer and heart disease, maintaining adequate vitamin D levels is crucial for overall well-being. But here's where it gets controversial. Are we doing enough to address vitamin D deficiencies in our communities? What are your thoughts on the importance of vitamin D in our diets? Share your opinions in the comments.